not sure that the report that the pandemic is over in the United States is entirely accurate. I do know that President Biden made a statement on 60 Minutes saying that he thinks the pandemic is over because of how people are behaving. But in the United States, I think they still have lots of challenges because they're averaging maybe about 400 deaths per day. Globally, we have about 1,600 deaths per day. And the agencies in the United States that would normally issue these declarations, like the CDC, have not done so as yet. And the WHO, we take a lot of our guidance both from CDC and WHO. The WHO, they have a special committee responsible for public health emergency. That committee is scheduled to meet maybe in a month's time. And when that committee meets, it would evaluate where we are with the pandemic and then make a decision as to whether we continue in the mode that we are in, meaning that we have a public health emergency. So they would have to change that status. But as of now, the status has not changed, and therefore every country would have to be on alert. There are a couple of things that we have to pay attention to. One is that we have new strains that are emerging, and so we have to pay attention to that. There's a new strain that has emerged, BA 2.75. This one is even more evasive so in the immune system is finding it more difficult to detect it. And they have now started seeing more and more of this strain emerging. So new strains are emerging. How that would play out clinically is another matter. But what we have observed is that the current strains that are circulating, BA4, BA5, they cause milder diseases, generally upper respiratory tract infections, and for most people. But for some people, they also end up with complications. So that's something that we have to bear in mind. Now, if you are not vaccinated, or if you have not received your booster doses, then your immune system would have difficulty reacting to the virus when you get infected. However, if you are boosted or you've gotten your vaccine doses, then your immune system would be ready to respond. And that's what we want. We want people to be ready to respond if they get infected. That then prevents them from having the complications of COVID-19. So in Guyana, we have that challenge where I think while we did good with the primary doses, the first and second doses, we did, I would say, really good. But for booster doses, we're not seeing a lot of people coming to get their booster doses. And if we want to protect ourselves, we really need to take our booster doses. So this is really important. So basically, if someone is bedridden, then the family can call us and make the arrangements for the team to visit. Generally, we do about 40 to 50 home visits every week. Last week, we were able to go out to about 40 homes, and it depends on the calls that we're getting. And if we're informed that other persons in the household would like to be vaccinated, then we also do that. So it's not just going to the household for the person who is bedridden. If the people in the household indicated that they would be taking the COVID-19 shots, then fine, we'll do that as well. We have maintained that people coming into Guyana should have evidence that they're vaccinated. And we are still using the primary doses. We're not asking people for booster doses. So once you can show evidence that you have had the primary dose, first and second dose, then we accept that, and that's the only requirement basically that we currently have. No, we didn't have any deaths. Right now, as I've said before, we have seen a downward trend in our infection rates, hospitalization, and also in terms of deaths. For 18 years and older, we are now at 81.1% of the primary dose, first dose. That means that about 446,683 persons would have received their first dose vaccine. In terms of second dose, we have administered vaccines to 346,531 persons. That's approximately 67.6% of the adult population. For the 12 to 17 age group, we have been able to administer 35,751 doses. That's approximately 49% of that age cohort. And for second dose, we have completed 26,239 doses, or approximately 36% of that age cohort. 5 to 11 years old, we have administered 8,391 doses. That's 8.2% of that age cohort. And those coming back for their second dose, we have administered 4,269 doses, or 4.2% of that age cohort. So again, this is an area that I think with the cooperation of parents, we can increase this significantly, but we need parents to give consent so that we can give their children the vaccines. Booster doses right now, for some people we have given them their first booster dose, and for others they have come in for their second booster dose. So for the first booster dose, we have administered 73,921 doses. That's about 12.6% of the persons who are eligible for boosters. And persons who have come back for a second booster dose, we have administered 3,273 second booster doses, or 0.6% of the eligible population.